Welcome back to In Focus SoCal. The White House canceled more than $800 million in research focused on LGBTQ health, cutting hundreds of studies on cancer, HIV, and other diseases that affect sexual and gender minority groups. A report by the New York Times found that 323 of 559 grants terminated by the National Institute of Health were tied to LGBTQ health. Experts say this action could harm public health and reverse progress made in preventing disease outbreaks. In Focus SoCal visited one clinic that's feeling the impact of the federal cuts.
How many tests have you given today?
Today, one, but I've been giving out about 6 a day.
Xavier Laporte Sanchez is the director of HIV and STI programs at St. John's Community Health in Los Angeles, where HIV and AIDS prevention and care is provided through its prime specialty clinic. Testing for HIV is one of the most crucial services they provide for early detection, prevention of transmission, and access to treatment for the virus. And now federal and local cuts to funding are putting those services at risk.
It's close to $500,000, and I mean, we count on these funds not only for us to continue to provide the service, but these funds go towards helping the community. Most of the funding that we receive goes back into the communities that we serve.
For now, prevention measures such as HIV testing and post-exposure medication are on pause for all Los Angeles County's Division of HIV and STD program-funded clinics.
Without our prevention contracts, we lose the forward progress that we've made to date to end the HIV epidemic by 2030.
Ray has been coming to the clinic every 90 days to get tested for about 3 years. She asked us to conceal her identity and use a fictitious name to protect her family. In March, she received devastating news.
I went into the office and I was being told that I was diagnosed with HIV. Emotionally, I was shot, physically not able to bear with the reality of things.
The St. John's Clinic also provides critical counseling for HIV-positive patients.
This isn't a death sentence. It's a managed care moment. I appreciate you allowing us, choosing us to be your healthcare provider, and we're going to all work together.
One of the first items to be impacted at St. John's was a transgender health program, which was funded through a CDC grant. It was immediately stopped during the Trump administration's elimination of funding for DEI programs.
The preventative services with St. John's Community Health is life-changing. Without them, I feel like it's going to be a very dramatic shift, and a lot of people are going to die.
Los Angeles County currently receives $19.45 million annually through a CDC HIV prevention and surveillance cooperative agreement. LA County's current grant expired on May 31st. And the federal government has been silent about the future of these funds, leaving the 36 community-based clinics in LA that provide HIV prevention services at a standstill.
HIV/AIDS continues to be an issue because it is a transmittable chronic illness.
According to the latest estimates from the Centers for Disease Control and Prevention, approximately 1.2 million people in the United States are living with HIV, and 13% of them don't know it. CDC estimates show new HIV infections decreased 12% from 2018 to 2022. Xavier says increases in pre-exposure prescriptions, viral suppression, and HIV testing have likely contributed to the decline.
Our communities not having access to prevention services will cause a dramatic increase in HIV transmission amongst all of the communities that we serve.
The development team at St. John's Community Health is now actively seeking private donations and grants to sustain programs and keep its staff employed.
We are not going anywhere. We won't stop. We won't stop providing you services. We won't stop being here for you. We will not stop advocating for you. We will continue to fight and advocate for your right to be healthy.